Hey, welcome everybody. This is Dr. Lisa Merritt of the Multicultural Health Institute, and I'm so happy to have everyone here for this April 19th, 2023 Healing Circle with a theme on mental health awareness and a particular focus on autism awareness. And we are really fortunate to have with us Dr. Stacy Greeter, my dear colleague at arms, as we try to do our best to help the community to stay balanced and to learn and to know how to find their own best wellness path. Dr. Greeter is a double boarded physician certified in both child and adolescent and adult psychiatry, who has a private practice in Bradenton, Florida. She graduated summa cum laude from Duke University and went on to University of North Carolina School of Medicine on a full scholarship. Dr. Greeter completed her residency at Northwestern Memorial Hospital and continued there to complete her fellowship in child and adolescent psychiatry. She loves sharing her passion for psychiatry with other professionals. And I will say I'm part of a book club that I can hardly ever get to, but I always look like interesting things she's studying. And she also wants to increase access to quality psychiatric care by educating primary care providers through her psychiatry bootcamp for primary care online lectures. She's a strong proponent for collaborative care between disciplines and leads the psychiatry rotation for family medicine residents at Manatee Memorial Hospital, teaches child psychiatry fellows at the University of South Florida, and runs a multidisciplinary mental health professionals book club, as I was just mentioning. So without further ado, I just want to thank Dr. Greeter for joining us and donating her very busy, precious time for our greater understanding and education. So take it away, Dr. Greeter.
Thank you so much, Dr. Merritt. Thank you so much for joining me for a topic extremely dear to my heart. I'm hoping to give people resources and guidance on how we can especially make our healthcare system more inclusive and better meet the needs of the autistic population, and welcome any questions people have too. So I am going to share my screen to start the PowerPoint. All right, everybody can see it okay. All right, so autism. I'm going to share a story to start about autism that I feel like really kind of captures. It's the autism penguin story, okay? We get this a lot. People are saying, I don't want my child labeled. And I think that the story, which I have here, the sparrows and penguins story. I don't know if you guys can see the story or you still just see the PowerPoint slide. Either way, it's okay. But this is a story that an adult wrote about being diagnosed with autism in adulthood later in life. It's called Sparrows and Penguins. So imagine that you are a sparrow living in a family of sparrows, in a town of sparrows, in a world of sparrows. But you're kind of a shitty sparrow, like the worst sparrow, actually. You can't fly. You've been to doctors who prescribe medication to help with flying, but you still can't. You try every day, and every day you fail, and this thing which all the other sparrows tell you is critical, you can't do it. So you stop trying. Failing every day just wore you down. It made a rift with your family. Flying is an important activity that sparrow families generally do together. So you try harder. Sometimes mean birds make fun of you because you're a terrible screw-up. For 26 years, this is what your life is. One day, almost out of nowhere, as an afterthought, as an aside, something barely worth mentioning because it is so obvious, a doctor says, by the way, you are a penguin. Holy shit, you're not a failure. You're a penguin. You're not lazy or stupid or weak. You don't have messed up values. You're a penguin. And you've always been a penguin, and there's nothing wrong with you because you're actually quite a good penguin, like the most perfect penguin. And it's just a fact that penguins can't fly. Now, when you're with sparrow friends and they're all sitting in nests, you sit in a bucket of ice. And sometimes mean birds still give you shit about your bucket, but it doesn't hurt as much as it did before, because you know that you're a penguin and you're exactly what a penguin is meant to be. You give yourself permission to stop trying to fly, and not failing all the time improves your mood and overall function. You finally feel confident declining when invited to flying outings. You don't waste the energy feeling guilty about it. You love your family of sparrows, but you also find a whole new community of penguins to love. Things that you thought were just you and weird, like preferring fish to birdseed. Things you thought that you were totally alone in and wrong for are common and accepted. You bond over how and when you discovered you loved swimming. Knowing you're a penguin means all the things penguins can't do. It's not a personal failing when you can't do them. You can do other things. Sparrows are actually quite poor swimmers, and you feel good about the things you excel at. This is why I think labels are important. This is why I think we're all birds. Let's focus on our similarities instead of our differences is harmful. And this is how my autism diagnosis was like breathing after holding my breath for 26 years. Let me make sure you guys are still seeing my PowerPoint, right? Yeah.
Yeah.
Okay, cool. So it's quite common in both females and children of color that they are much more likely to be diagnosed later in life, more likely to be missed. And now we're all probably aware that earlier diagnosis of autism indicates, better functioning when you're able to get help when the language centers of your brain are still developing a lot. But there's also like the long-standing trauma of not understanding how your brain works differently, and the demoralization of not understanding why you're consistently failing in certain ways, and that being labeled as weird or being not right, as opposed to, yes, this is my different type of brain. I think that I also like the autism versus penguin story because it emphasizes how saying, oh, everybody's brain is different is invalidating and dismissive to this population in many ways, because it's one thing when there are idiosyncrasies that differentiate us, like, my lifestyle choice is I like chocolate ice cream and your lifestyle choice is you like vanilla, versus my brain cannot do the same things that your brain can do. And that is painful, and discovering that, while it can be painful to face, is also liberating for people to understand this difference. We'll talk more about some of the strengths of the autistic brain that people aren't as aware of. Okay. So one difference is that girls may appear much more social than boys, and that make it easier to miss them in the autism diagnosis, but they still really struggle with understanding social hierarchy, and are often on the peripheries of friendship groups and tend to have intense friendships with falling out periods. I also saw in the research that I read that there is a correlation between the educational level of mothers and whether they are able to notice that their child is developing differently, or even be aware of what autism is. And so that's certainly going to create a lot of disparities where mothers of higher educational levels are getting their children identified and diagnosed early, and mothers of lower educational levels are just, those children are being missed. I think that it's important to validate adults who are diagnosed later in the pain that they have suffered. So one myth is that autistic people lack empathy. So, they're not sociopaths. There's different types of empathy. So there's affective empathy. Affective empathy is feeling with people. Okay, like when you are sad, I notice, you are sad. I feel sad with you. Okay. And then compassionate empathy, that's feeling concern for you. I want to help you. I'm concerned about your pain and suffering. Okay. This is not impaired in autism. As one study showed, it's cognitive empathy, which is also called perspective taking, okay? That is your ability to take in information and make educated guesses about other people's thoughts and feelings, okay? So they're very caring people, right? And feel with people and for people, but it's harder. There's also studies showing that autistic people are better than non-autistic people at cognitive empathy when it comes to other autistic people. So they can do this. It's almost like they can understand what another autistic person and perspective is better than they can understand what a non-autistic person's perspective is. Okay, which kind of makes sense, honestly. So understanding that the lens through which we are viewing people with autism is often a strictly neurotypical lens, and there's more to it. Whoops. Okay. So I wanted to go over stimming, and what that is. Okay. For autistic people, when they're stimming, like flapping hands or jumping or rocking, it can even be as subtle as rubbing fingers together. This is serving an emotional regulation function. So while, it may make a neurotypical person, and when I say neurotypical, I use that also to mean someone without autism, a little uncomfortable, I think it's important to understand that often people with autism do that to emotionally regulate. Um, and that this is something that can discharge nervous energy for them. So you often see it when they're excited or they're anxious. And it's important to not, I think, be inhibitory of them doing this regulatory activity. I also want to highlight the sensory differences. Now, there is both, there can be both a need for more sensory input and their brain reading certain types of sensory input as too much, okay? So it's interesting that people with autism, generally speaking, have a high tolerance for pain. It's called an autism spectrum disorder because it is so heterogeneous. It is so varied. So these are all generalizations that are not going to show up in each autistic individual. Patients with, so people with autism can also be very sensitive to certain lights, sounds, or noise. Studies actually show that they have more acute hearing and smelling often. And while for a neurotypical brain, a certain light or a certain sound that we just find as a general nuisance, it's very different for someone with autism. It can completely overwhelm them. A very different sensory experience for them than what we have. This also often affects eating, and they may need help with enlarging their food palate because of texture issues with food. Now, for us in the healthcare profession, I want to do kind of a special focus on that. There's interoception, which is our fancy word for the body's ability to recognize internal cues and sensations. This is generally less distinguishable in kids with autism and adults with autism. They struggle to detect when they're hungry or to know when they're full, recognizing their thirst, relaxing tense muscles, knowing when their bladder is full. So understanding as medical professionals in particular that it's harder for someone with autism to give us feedback on how their body is physically doing is really important. And this can be life-threatening for some people with autism. Matt Lowry, this website here, lpp.com, has tons of autism memes. And this kind of is a good summary, right, of a lot of the areas that are impacted by autism. So with autism, your proprioceptive, that's how you feel your body in space, is different. Okay. So, like I said, you may need extra movement to feel secure and safe. People with autism perceive the world differently, both hypersensitive and hyposensitive to stimuli. We talked about stimming, which is the repetitive movements or sensory seeking things that autistic people do to regulate emotions. And then special interests. Okay. Um, with autism, they have an intense curiosity and excitement for a particular area. That's what we call a special interest. And if you want to connect with someone with autism, it's very good to figure out what their special interest is, because this special interest isn't just like what you would think of as, oh, I enjoy talking about my hobby. It's more of they want to do a really deep dive into this specific area, and they really use that specific area to connect to other human beings. There's a lot of executive functioning issues with autism. Demand avoidance, I'm going to explain that a little bit. That is where you have to make a phone call. And for a neurotypical person, it's like, okay, what's the big deal? Pick up the phone, call your doctor, schedule an appointment, you know? But for someone with autism, this change in schedule, this requirement of making small talk, this taking initiative to make a phone call can be a really, really big deal, which then leads to avoidance of such demands and then procrastination. And then like it's going to be a long time before they can actually get their medical needs met. As well as the difficulties with executive functioning, impairing their ability to process and remember information and take medication regularly. They're very sensitive to rejection and may develop what's called masking. Masking is the term when an autistic person Temple Grandin refers to this as like being like in a play, right? So the autistic person learns how to kind of fake being neurotypical and like talk just the right way, so that other people don't pick up on their difference to avoid rejection. And you might think, well, what's wrong with that, right? But it comes at a great emotional and cognitive cost, where that can lead to what we call autistic burnout, that they're devoting so much energy to faking it, they can only do it for so long. So that doctor's appointment where they had to fake it to like, not be rejected, takes a huge toll, and they're exhausted afterwards and can't do anything else, okay, because of the demands of masking. And then of course there's the communication differences, and an intense emotional overload. And we talked about the struggles with interoception. So this is a great website you can go to if you want to see some more information on autism. I'm going to talk about how we connect with people with autism, because I think that's important. That they are going to connect differently. I think that it's a myth that people with autism are so-called like loners or don't connect as much, right? They're just going to connect differently than someone with a neurotypical brain does. So, understand that neurotypical rituals of connection, like intentional eye contact, I'm interested in what you have to say, can be a threat to someone with autism, because the eye contact, not just that it's like, oh, it's hard for me to make eye contact, but literally that eye contact in their brain can register as lack of safety. Okay. Small talk, talking about kind of just for the sake of, having, opening up the conversation. That's very difficult for someone with autism when it doesn't have a direct purpose. That vague, open-ended questions can actually be aversive. Okay. that sensory stimuli that we would consider just a nuisance, okay, or may not even notice, can completely derail their ability to process information. Kind of like you can't hear a small bell ringing, doctor trying to give you instructions, when there's a bomb going off in your head, or like an alarm almost going off because of the sensory input of the lights or the sensory input of your clothing. That if you are a healthcare professional and your patient comes in and they are pacing, then it's okay and helpful to let them pace and not insist that they sit down, and to mirror them. So if they're pacing, you can stand. If they want to sit on the floor, that's fine too. If you can offer them a fidget, and you can use a fidget as well to kind of mirror them. And that helps them become emotionally regulated, understanding that the safer and more emotionally regulated someone is, the better they can connect with you. We don't want to connect when we are not comfortable and not feeling safe. So that's important. And so, yeah, if you're a healthcare provider and your patient is wearing a Pikachu shirt, you have a great idea of where to start. That, instead of the open-ended question, be like, tell me about Pikachu, okay? And get a lot more traction that way. So autistic patients, because they struggle with alexithymia is our fancy word for difficulty picking up on feelings in our body, recognizing how we're feeling. Am I sad? Am I angry? Am I scared? And then impaired interoception, again, that's our term for how we perceive body cues like hunger, fatigue. Um, Open-ended questions about feelings and bodily sensations can be completely overwhelming. And now we have to understand that it's a very vulnerable place to be a patient, period. Okay. And so when you're a patient with autism who has unmet healthcare needs, that's extremely vulnerable. You're used to being rejected a lot. So they're sitting there like, oh my God, I have to come up with the right answer, or I'm going to be rejected as like a weird, rude person again. Okay. And yet I rely on this person, like I need them to get my healthcare needs met. And then, it's very difficult for someone with autism often to assertively advocate, which we need to do. Unfortunately, it requires a lot of self-advocacy and kind of so-called being a squeaky wheel, to get healthcare needs met. So all of this is really putting the autistic population at a disadvantage. There's actually statistics that autistic people die much earlier and struggle with a lot more health issues than the general population. That being said, also interesting is that there's a lot of overlap between autism and a lot of autoimmune conditions. Overlap between autism and Hashimoto's, thyroiditis, Ehlers-Danlos syndrome. So they have some extra healthcare needs here. Some strategies for connecting, I say be direct, concise, and as specific as possible. Instead of asking like open-ended, how's your sleep? You could ask, do you have difficulty falling asleep, staying asleep, or do you sleep too long? It's helpful to give an autistic person a roadmap of how an encounter will go. Like I'm gonna start by asking you questions about this, then we're gonna do this exam, and at the end, I'm going to give you a medicine and da-da-da. Like giving them a roadmap of like, okay, so this is how this social encounter is gonna happen. Tell them what's expected of them. Allow alternate forms of communication, such as writing. I find it really helpful, because as a psychiatrist, I'm asking people a lot of really complex things. And so instead of them having to sit there like a deer in the headlights, oh my God, I don't know the answer to that question. I give my patients sometimes a written list of like questions they can expect to be asked at the appointment, and they can take their time writing some responses for us to go over to really take the pressure off of them to have to on the spot in a setting that they're already kind of scared and uncomfortable, come up with answers that they need to give me the right answer to be able to get their healthcare needs met. Giving written instructions to take with them from the appointment is really helpful, especially with the executive function issues. And if you can give them any assistance with things like phone calls or where they have to reach out, and that's really helpful. So tell them what explicitly you want from them. I put just a little bit about differential here, okay, because struggling with social skills and struggling to connect can be related to a broad range of different psychiatric diagnoses, right? With ADHD, the difficulty is often impulsivity, and because there's just other things that are more interesting that's grabbing the ADHD kids' attention, they may be not aware of social cues. With depression and anxiety, children are often socially inhibited, right? They're too anxious. They're in that sympathetic fight-flight response a lot of times, in that threat-focused place with the sympathetic nervous system. And so they can't get into our ventral vagal nervous system and calm themselves enough to be open and connecting, right? With conduct disorder, there can be a lack of concern for others' feelings, which again is not the case with autism, where it's difficulty understanding another, specifically actually a neurotypical person's perspective. So I did promise to talk about strengths of the autistic brain. Generally very good at pattern recognition and notice things that other people just don't notice. Tend to be very good at analyzing something, and they do a deep dive on what they're really interested in. So like if they will become super experts on an area of special interest. They tend to be very rational and very sensitive to fairness and justice. They tend to, not buy into the social hierarchies. So they're very egalitarian people who are like treating everybody with kind of the same amount of respect. This can get them in trouble with bosses. Higher visual acuity, heightened sense of smell and hearing, and a high drive to analyze and construct detailed organizational systems. I wanted, part of why I read the Autism Penguin story was to specifically highlight adults with autism. Many people are diagnosed with autism in adulthood for the first time. So if you're a healthcare professional, especially, and a vulnerable person is coming to you and they say they have autism, please do not dismiss that. Recognize that they may appear normal to you because they have learned to mask their symptoms for a very long time. And if you respond by, oh, no, you don't have autism, you're good, this is not a compliment. This is something that's invalidating for them, unfortunately. And many adults are only recognizing these symptoms in themselves after their child is diagnosed. So I want to also note that just because a patient is autistic does not mean that they are asexual. It is true that there are higher rates of asexuality in autistic patients. There are also greater rates of gender and sexual diversity. So people with autism have a higher rate of not identifying as cisgender and not identifying as heterosexual. So some of them are getting a double whammy here of being in a disenfranchised population, unfortunately. Specifically, rates of transgender identity are 20 times higher in autistic adults compared to the general population. Also, unfortunately, autistic females have much higher rates of sexual victimization than neurotypical females. So these are some things to be aware of, okay? All right, I'm going to close for questions. This link is to, I'm going to share the sheet. Hold on, share screen, where that goes. All right, I'm going to share here. So on my website, psychiatry bootcamp section of my website, I have some resource lists. Here is the autism spectrum disorder resource list. It has some rating assessments if you're a clinician that are free to download. And there's rating assessments for adults too. Principal information, the sparrow versus penguin story, various autism websites, various information for clinicians, and some of my favorite books on autism. One of the ones I start people on a lot of times is Divergent Mind, Thriving in a World That Wasn't Designed for You by Janara Nuremberg, that I think is, really helps with understanding a lot of our neurodiverse population. All right, so now I'll see what questions are in the chat. Okay. Dr. Yes.
I just wanted to thank you and say, first of all, that was so excellent.
Oh, thank you.
And so
thank you,
resonant, and we appreciate your candor and also just the way in which you speak. As a physiatrist specializing in brain injury, a lot of what you're speaking of also applies to that population as well. And, there's also the gifted population that have some of these issues. And so it's really important to kind of meet people where they're at. That was just a comment I put in there about the sensory issues and how debilitating that can be for people.
Yes, that's why I described it as like, if you're, in a healthcare professional's office and there's like a bright fluorescent light, it's hard to comprehend if you live inside a neurotypical brain, what that's like. That I likened it to, trying to hear a bell ringing when there's, an alarm blaring in your mind. You cannot process information when your sensory system is being overloaded like that. So we need to understand that those sensory differences are more than just nuisances, and, accommodate them and encourage people to get diagnosed with autism, learn about their brains, and then accommodate their brains so that they can thrive. Find strategies to accommodate themselves. Yeah.
Yeah, I think you bring up some really good points. And then in terms of function as a physiatrist, it's really important to anticipate these possible scenarios. When I used to travel, I used to always have a bag full of things to entertain, and a chewy thing, and the fidgeting devices. You can have a thing around the neck that's a little easy to just, have people to chew on and things like that. Those things are important to anticipate, so you're not in a situation and not have some compensatory strategy.
Yeah, if you're a healthcare professional, being open to not just, if we could, I'm hoping that we can move towards a culture where when there's a person with a different type of brain who needs to connect, that we can view what they need not as disrespect or not good manners, or this is how you have to be, right, in this particular social situation, yes, doctor sitting on the sofa, right? And we can understand and be flexible and see it through the lens of, this is what that person needs and this is how I connect to them.
And I think the energy also about the masking part is so important too. That takes a lot of energy to just kind of quote act normal, keep it together. It can be hard for family and other supporters, because once that person then is in a safe zone, then it all kind of comes down and comes out. I'm sorry, Rebecca, you were going to say something?
Oh yeah, I was just just thinking about kind of the stimming and things like that, and how important it is for the general population to know and understand that, especially I think in the school system for kids who are going to school, because most of the time in a school setting, kids are expected to like sit in their chair the right way and not talk or make eye contact. Even for the younger kids, there's a lot of push for what it means to be respectful, and they say being respectful means to make eye contact and do this and that and the other thing. And so I think just educating general population about those differences and that it's not disrespect is important.
This is not disrespect. This is really important to that person's survival and functioning. This is their version of self-care, not disrespect.
Indeed.
Yeah, good
I have
point.
another
Thank
question.
you.
What is the best way for the person to kind of let other people, especially people that may care about them or they may care about, to know, to let them know that they're not being offensive, how to communicate some of the challenges that might arise in misperception.
Yeah, I think that's really, really hard because there's a lot of, internalized ableism, unfortunately, that like I think putting it's hard coming from that lens because I think that from a very, very young age, the internalized message in an autistic person's brain is like, I have a bad personality. And, that's why people are rejecting me. There's something wrong with me. So then to have I think they would need like a lot of great therapy and time and healing to come at it from a place of, wow, I have a great personality. I just connect differently and, here's what's going on for me. So I don't want the onus to be like on the autistic person, but yeah, if they can, great. And explaining, I think that I encourage patients with autism to share with as many people as they can and feel comfortable with, right? Because it is difficult and we want to be selective. Not everyone is a safe person to share it
Right.
with, that their brain is functioning differently and to please let them know if they're finding something is off so that there can be a direct communication. I felt this when this happened. Oh, well, I was feeling this and I meant this. Okay. Um,
Yeah, I mean, I
work
think
that
the
out.
ask for help to be direct is an important one because
Yes.
a lot of times people are not specific and they're indirect or they intend or they give nuance or they're
Yeah.
being polite. There's a lot of
Mm-hmm.
politeness that happens that is really lost to people with autism and neurodiverse issues. That it's
Yes.
very black and white. Like you have to be really clear. I need you to do this. I don't like when you do that.
Yeah.
And they won't take offense where it might feel like if you speak like that to other people, they
Mm-hmm.
take offense.
I
And
mean,
I think that it's,
I think
it's a
there's
learning
like,
process.
I think there's a really precious authenticity to a lot of autistic people.
Yeah,
A precious level of being genuine,
right.
where you cut through kind of the BS.
Yes, it's very
Um,
clear. It's real super
so
clear.
I love that, and it works great for me as a psychiatrist. I'm extremely direct in my communication, so I really enjoy that and love working with the autistic population. I really do.
So
Yeah,
I
I
have a
think that's a
question
gem.
for you.
Yes.
What kind of advice would you give an adult who is maybe thinking that they'd like to
Mhm.
go, discuss this with their doctor about who to look for or what kind of person to talk to? Because I think there's a lot of stigma around mental health in general. And I think, there could be a lot of anxiety or people maybe, questioning themselves, like, am I taking
Right.
space? Is this really me? Am I really, or am I
Yeah,
just going to
I
take
agree.
space up in this,
And
environment?
like, honestly, at this point, I think an autistic person, I mean, yes, of course, you might be surprised because you might be like, oh, don't self-diagnose. But I kind of think that an autistic person, if given the right information, may be the best person who understands their experience of the world and can diagnose themselves. And like, if you give them the right tools and resources, and they'll do like a deep dive into what autism is and trying to figure out whether they have it and can generally be trusted, right? For the most part. I do think on the flip side, there are some situations where there could be a drive to get an autism diagnosis when that diagnosis isn't present to avoid a diagnosis that maybe carries more shame and guilt, which is sad, unfortunately. Like, I don't have a personality disorder. I have autism. Well, right. But I think that's rare and
Yeah,
it's
or
more
people
common.
seeking to get special accommodations who
Yes,
really don't
right. So I don't want
qualify
to pretend that there aren't, it's not like it doesn't exist that people don't co-opt the space, right? But for the most part, I think that a particular individual knows themselves best and can really do a deep dive into this. And there
Right.
are neuropsychologists who would be specialized in diagnosing, but honestly, in most, oh man, most doctors can't really diagnose an adult with autism accurately. I'll just be honest, that's sad, but I just don't think that the general awareness of what that looks like in a high masking adult who's masked for years, I wouldn't trust that. So I would say
Yeah,
trust
I agree.
yourself, you know, and you know, at the end of the day, think like, does this inform me in a way that I am able to emotionally regulate better, able to connect people better, and accommodate myself, right? Because that is the purpose of a diagnosis, okay? The purpose
Right.
of a
To know what are you going to
diagnosis
do? Mhm.
is to enable us to to promote self-understanding and self-accommodation,
And to function better.
you know?
Yeah, and to improve our function.
Yes.
Yeah.
Now, I mean, and so I mean, I would say a psychiatrist, a specialized psychiatrist who's like, I specialize in autism, or a specialized neuropsychologist who's like, I specialize in autism and I'm skilled at diagnosing adults, and also trusting yourself.
Yeah, and I think occupational therapists, which is another type of treating entity, they're not physicians, but
Right.
they can be very helpful in treating that population, and they can also be helpful in assessing and picking up on the kind
I
of
think with the
nuances, especially the
sensory
sensory.
issues can be helpful in treatment. I don't think I would trust them for the diagnostic
No,
part,
they
but I
can't
think they can
diagnose, but they
definitely
might
help.
they might pick up on things, and then through their assessment can then say, hey, you can take this, and this might help qualify people. I'm trying to think for our care navigators,
Yeah.
the kind of steps in terms of advising parents, because it's so hard to get mental health services and to get to any kind of a real qualified psychiatrist right now.
It is
And
hard.
occupational therapy is another form of assessment that, especially dealing with the schools, that when you have some indicator of some sensory integration challenges, and that becomes more, I don't want to use the word fuel, but I guess it is a way to help get to a referral and to get to the neuropsych and the psych, the speech therapy, cognitive and other types of evaluations that might be necessary. But I think what's also useful about OT is once you identify if that person is sensory seeking or avoidant or modulating, because some people are both.
Mm-hmm.
And sometimes they're seeking, sometimes they're aversive, sometimes they, and to understand then what are good techniques to manage that, because it's all about keeping the nervous system moving in its balance.
Yeah, I think anything we can do to help people shift their internal narrative from, oh, I'm weird and messed up, to, oh, this is what my brain needs, and here's how I can meet that need.
Right. More positive framework.
Yes.
I totally agree. I'm really curious. You mentioned, I'm sorry, I wanted to ask about the increased sexual trauma. Is that from not reading social cues, or what's that?
It's hard to say. I
I
think that they, I mean, who knows? There's so many different things that could cause that, right? But I think in general, I have unfortunately a lot of autistic patients who are victims of sexual trauma, and I think part of it is that they are easier victims. And it's especially scary with nonverbal kids who, how are they going to express what's going on? Yeah.
Go ahead, Rebecca.
I was just going to ask about how common is it for it to run in families, for autism to run in families? Is it part of the time sometimes?
Yeah, pretty common.
Yeah, it's common. That's what I thought you were going to say, but I just
like, I could look it up on the internet for you, the like genetic concordance, but it's pretty common. And so I think what I often find is, there's different degrees maybe within a family where a kid is like, oh, this is clearly, it's clear this is autism. And then an adult is kind of like, oh, You know, like I have some of this. I don't have all of this, right? Or to this extent, but a lot of this. You know what I mean? And so I think the autism spectrum is kind of apt. Yes. Yes.
And there
Okay.
it's common to have co-occurrences also, right, with other
Especially ADHD and Tourette's and
Yeah.
OCD. And then unfortunately in the teenage years, a lot of anxiety and depression.
Yeah.
You know?
Yeah.
Increased risk of bullying. Yeah. Yeah. I would say most people with autism also have ADHD to the degree that it used to be that you couldn't diagnose both autism and ADHD because it was thought that ADHD was like just part of autism, right? And yeah, now they are separately diagnosed, but there's huge like numbers of overlap between ADHD and autism in particular. Yeah.
Wow, that's really interesting. I had a chance to hear and meet Temple Grandin. She was really fascinating, and the
What
work
was
that
that
she did.
like?
Well, it was really very inspiring for us both, and to really have an understanding. Especially, she showed some work that was being done that actually was able to map the visual cortical brain pathways and how different they are, and then to tell her story in terms of understanding the way cows. You know, part of her work was changing the way in which they direct cows ways into the whole
She's
slaughterhouse
kind of
thing.
like the world's most famous for being autistic famous person, but then there's like so many famous people who we don't talk about being
You don't know
autistic
about
but
that,
are
right?
autistic. You know what I mean? Like Albert Einstein, right? You know,
Right.
the list goes on, right? But she's like the kind of
Yeah,
first.
and what's beautiful is she talked about how she had to work at learning, you know, the social pragmatics, which was inspiring. That she had, it's almost like a kind of the performance required in order to even just get up there and speak to people.
Yes.
So tolerate her mother hugging her because she really hated to be touched.
Yeah.
And understanding that was important to other people. You know, like a lot of times when Merle said, well, I know this is important to people, like will be framed, you know, like, and theater, I think, is another way. But, you know, the way that she was able to get into the minds of these cows and see it from the cow's point of view and the way that their eyes are on the inside of their head and change the guidance system, because she understood it was about fear. It was in what was happening before was initiating a fear response because the shadows and things like that, like a whole different way to be able to visualize things. So there's so many
A
gifts.
different way of looking at the world.
Different way of looking at the world, for sure. And I think that, again, the more we celebrate the gifts of it and in this uniqueness. Another good book is Born on a Blue Day, about the man that did the longest public recitation of pi. Like he talks about the patterns and how he went about memorizing all of these digits of pi and different sequences in his mind, the way it looked and felt. So this whole synesthesia that happens sometimes is, you know, and I've heard it told to me that, you know, certain things can look and make you feel good, but they can also feel very uncomfortable the way that it looks. You know, and that certain things and smells and tastes, same thing. You know, like we had a whole thing starting the day today because Amara walked in, something did not smell right, and how she literally had to go outside and regroup herself because she was so thrown off because something I had cooked on the stove or something provoked this incredibly triggering response. And then in certain places that we've gone, or buildings that we're in, like she will not go back because of the way it smelled, and she'll remember from years ago, from when she was 9 years old or something. It's so embedded. Like,
I think
doing that.
I think it's so important to celebrate these strengths and also not try to gloss over or sanitize the pain and suffering that comes with being autistic in a neurotypical world. The most autistic friendly town, there's an autistic friendly town, an autism friendly town in Ireland, Clonaki. You can look it up on the internet. The movie theaters are lower volume and all these things, you know, and they don't have the fluorescent lights in the grocery store. And yes, you guys should look that up. Autism friendly town.
Wow,
Yay,
that's pretty amazing.
yay
Yeah,
for
good for them.
Ireland. But okay, in most places, yes, it is very difficult, challenging, especially challenging. Yes.
Yeah, so the pandemic in some ways for some people was a bit of a blessing because it took off so much pressure of having to interact, having to emerge, having to, there's a population for which that was really quite fine and not have to make excuses or anything. It was like it was a pandemic, not dealing, really
Yeah.
self-isolated in a
And
way.
so I think if we can just approach people from instead of assuming, oh man, that person, doesn't like me or disrespects me, but maybe something else is going on and be curious,
Yeah, give the benefit of the doubt.
Mm-hmm.
Yeah, I'm curious to the rest of the people, at least on the call with us, if there's any other comments or questions.
Yeah.
Was this helpful, Bonnie? Or you have any input? I know you have been talking a lot with the public and people in the community, and there's a lot of issues with this in the community, and especially in the Black community. People don't want to talk about things, or they want to, the whole idea
And
of sit down and
rightfully
be quiet
so
and
that
behave.
the Black community mistrusts the medical establishment,
But
Just being outside.
that makes so much sense what you were saying about people when they don't want to be touched and different things. You're absolutely right. We number one assume that it's the worst scenario. They don't like us or they just whatever. And it could be something totally different. We need to be more mindful of these things because we're not. All of us. You are because you're in the medical field and you understand that. But if you don't understand it, you don't listen to these talks when you trying to explain to people what's going on, you still will be in the dark. And that's why I think that this is very important. And I don't know why people don't want to get on and learn about what's really going on.
Thank you, Bonnie. I appreciate
Bonnie.
that.
Well,
And like I'm a psychiatrist, so I know about this, but a lot of medical professionals don't. I really hope that more medical professionals can find ways to make their practices more friendly to autistic people.
Yeah, and then people really cannot help. There's different kinds of capacities and different kinds of wiring. And I think it's so good to get this word out here and to also understand that when children, they're going to tell you in their own way, the best way that they can, if their needs aren't being met or if they're uncomfortable or if they're not in a good space. And it's up to us to try to read that and make that space comfortable to be most available to them.
Right, and not judge their parents too, like, oh, that parent can't control their kid, or not judge the autistic person, and please not judge their parents.
And I mean, I think there's also the issue of environment. We're doing this environmental justice workshop on the 24th and the 25th, and the whole challenges in environment. And we need to recognize that, especially in the Black community, again, there's a high degree of environmental toxicity located in many communities, even across the country and even in our own. And that we know that when there's higher levels of the toxicity and fine particulate matter and heavy metals and toxic things, that there's neurological effects as well as respiratory effects and can affect development. And so we really need to try to keep our children safe. We need to try to use filtered water. We need to try to keep them inside when the dust is really strong on those kind of days, and check the lead levels, which it's gotten a whole lot better since they took lead out of paint and things, but still we still have problems with lead, which is treatable, but could very much impact a child's development if they have high levels of lead or sources of lead exposure.
And it's going to impact people of lower socioeconomic status and people of color more.
Right. And so those are treatable, preventable things. And that could also cross over into the sort of the neurodiverse diagnosis, but it's like you may be missing this toxicity component. And we don't know with autism, is some of it because of environmental toxicity issues affecting the genome. We don't really know why. Is it because we are better at finding it now? Or is there something going on why it has increased so much in terms of the prevalence? It just seems to be far more prevalent.
It is increasing, and I don't know how they determine this exactly, but the research studies are saying that the increase is such that it cannot be explained by just increased diagnosis. or
Right. There's
increased
something
awareness.
going on. And, my sense is nutrition is one thing for sure, because we're not eating as much food grown from healthy, rich, nourishing soil and without so many additives and preservatives and all these other things in it. And we don't know what that does, but we know that in California, they banned certain colors and they're going to ban some more because they feel that it's adversely impacting developing brains. And there's something to be said for that. And we'll be having Mr. Billot speaking on as part of the movie Dark Waters, and he uncovered the whole truth of DuPont and forever chemicals, PFAS and PFAS. And we don't really know what that's going to mean for this whole generation that's now been exposed to that throughout the world. It's not even really being detected. Mm-hmm. So it's important to be aware as we want to protect ourselves and our children and maybe reduce further exposure or give the brain the chance to recover, because there are situations where there is improvement in function through occupational therapy, other types of things that work for that person to self-manage, to minimize the triggers, to improve the dietary challenges. Not everything works for everyone. Some people, the wheat gluten thing may be an adverse thing, may stimulate further inflammation. We don't know, but for some people it really helps improve function, so it's worth restricting that. Some people, they need more vitamins. Some people are just undernourished because they can have very selective dietary issues because of the sensory stuff, like they will only eat white things, or they will only eat things in a certain shape, or they'll only eat 2 different kinds of food. I mean, they can really, and then you're running into nutritional problems, and vitamin supplementation might be important as well. Yeah. So this has been great. I mean, is there any last thing you want to share with us before we close for the evening, Dr.
Thank you so much for giving me a voice here. And it's really, it really helps me to have the opportunity to speak out for this population. Thank you.
We appreciate you. Could you tell us one more time that website that people can go to get information? Could you tell it to us, please?
Okay, so the easy one is, so my website is stacygreetermd.com. And then there's a psychiatry bootcamp section where you can download my autism resource list. And it has a list of
Stacy
websites.
Greeter.
It has
like
a
store
list
reader,
of websites.
Greeter, right? Okay.
Yeah.
So those list of websites is wonderful. We'll make sure to share that with our navigators, and so they have that available to share with people. Yes. Team, any other questions from anyone else for Dr. Greeter? This is such a great gift.
Thank you so
much. There will be people that will watch this afterwards. We really appreciate it. So
bye.
End Facebook. Okay. Thank you.
Thank you.
All right. So
cool.
On